I'm Edwin Warfield. I'm the publisher of CityBiz. I'm honored today to interview Florian Otto, who is the co-founder and CEO of Cedar. Welcome, Florian.
Thanks a lot for having me, Edwin. Really appreciate it.
So your career included stints at McKinsey, Groupon Brazil, and ZocDoc. Can you tell us about your career path prior to launching Cedar?
Sure, very happy to do that. And it starts, of course, a while back, originally from Germany, as everybody I think can hear from my accent. I studied there medicine and dentistry and was a maxillofacial surgeon for some time and did my PhD. So it was a pretty academic career. And then after graduation, I joined McKinsey and Company, so a business consulting firm, and worked there in healthcare consulting. So did a lot of provider projects, health payer projects, government healthcare, and moved to Brazil for them. So I spoke already Portuguese before and was really excited and passionate about the country. And then moved to Rio de Janeiro and worked there for McKinsey. And then in 2010 started a company, same business model as Groupon. And Groupon bought the company. I became CEO of Groupon Brazil, and did that for 3 years. And then joined ZocDoc. So moved to New York and was the head of sales, so everything on the commercialization space. And then in the very beginning of 2016, started Cedar.
So let's talk about 2016 to 2019, and you had some personal experiences with our healthcare system that really led to the launch of Cedar. Can you tell us about that personal experience that you had?
Yes, sure. And it actually includes my wife as well, because she was the real person suffering from it. So a typical story, what happened. So she fainted on the street, which sometimes happens, probably low blood pressure. We needed to take her to the emergency room and then swipe the credit card for the co-payment. And then, of course, thought everything was done. Nobody communicated anything to her. And then a month later, she got a stack of papers that literally everything was written in caps letters and in strange codes. She tried to pay that through the payment portal and somehow didn't accept her card. So she needed to call in order to pay. And then another month later, she got an invoice from the imaging center where there was a slip of paper. She needed to fill in all her credit card information. And then half a year later, a debt collector called her for a bill that she never received for the lab company. She, of course, was totally frustrated and told me never take me back to that hospital because she lost totally trust in that health system and said if the administrative department is so organized, she lost trust in the medical part as well, which I think actually made sense, right? So it was a great experience on the medical side, got completely overshadowed from this billing nightmare that she had there.
So talk about some of the milestones from the launch through last year, really prior to COVID. Walk us through some of the key inflection points.
Yeah, very happy to talk about that. And I think the very first is, of course, as an entrepreneur, you really want to find this ideation phase, right? Because when you're faced with a problem like this billing problem, not immediately you say, okay, let's start a company. But you need to do a lot of, I think, research and investigation, whether you really want to tackle that and whether it's solvable. And the interesting piece was we did more and more research about it on what is really the consumer problem and what is the provider problem. And we found that the classic conception where the providers had that the patients don't want to pay or that they cannot pay, this typical willingness or ability to pay, is actually not really the problem. Because if you just look on Yelp or Google reviews, the number one complaint from patients is the billing is really messed up. Then when you ask providers why that is, they say it's because willingness or ability. But there's a very interesting stat that we found out that in general, more than 90% of the patients in general want to pay their bill if it's easy, if it's convenient, and it's transparent and fair. And most of the patients can pay their bill. So in the US, there are actually 25 million people with a bad credit score because of medical debt. And those patients have otherwise a clean credit score, and the median outstanding balance is $250. So clean credit score, $250. This is not ability to pay problem. We all agree with that. So long story short, patients want to pay. In general, patients can pay. but the healthcare provider make it extremely difficult for them to pay. That was our hypothesis. And what is the fundamental problem? Patients are basically exposed to any on-demand technologies, right? Everything is personalized, everything is convenient, immediate, and transparent. When you hail right now your ride, or you watch your movie on Netflix, shop something on Amazon, book your trip on Expedia, that's basically where everything is. But when you get your healthcare experience, it is completely one size fits all. Same bill at the same time, 30, 60, 90 days, and that's it. So we said it actually makes no sense that it is very different. We heard again and again healthcare is different. That might be true on the medical side, but the consumer is exactly the same consumer that is also exposed to all of these other on-demand technologies. So we wanted to bring healthcare billing to the 21st century and apply some of the techniques that work for consumers and what are their expectations towards healthcare billing. And I think there's this very interesting saying which says, your best experience anywhere becomes your expectations everywhere. And that is one thing that we really said, okay, we want to bring that to healthcare. So started the company back, as you mentioned, in 2016, got really passionate about the problem. We thought it was solvable, launched it with the idea of having something that is extremely consumer friendly, that is personalized, and started with the first healthcare providers. And that is literally how we got started, starting with one or two of the larger practices here in New York to really figure out, okay, how do patients interact with this new technology? Do they really like it? And measure the impact on what is the patient satisfaction? What is the payment rates? What is the time to payment? And of course, what is the cost to payment? So all of those four things we measured, and we saw the results were actually really good. And that when you reduce the friction, patients are delighted and they want to pay, and they pay more. And that's, of course, great for everyone. So it's kind of this triple win that we had. And then, the rest is history. Then we started and scaled it.
And so give us a snapshot of where Cedar is today in terms of patients per day, employees, some key partnerships.
Sure, happy to talk about that. So right now we are a bit more than 5-year-old company, serving overall more than 10 million patients per year, have 35 health systems as clients, have right now around 185 employees based in New York. Some of them, of course, are remote, but I think 160 are based in New York.
And so let's talk a bit about your product. What are the key features of Cedar Pay, and what has been its impact on patient collections and patient satisfaction?
Sure, happy to talk about that. So I think the key features of the product is the first pillar. We literally say it needs to be a delightful experience for the patient to interact with our app. So what is that? It needs to be extremely easy to log in and to review your bill. It needs to be extremely easy to understand. So we are translating codes into human understandable English. We are merging different invoices together for the same visit so that you have one system like in wallets and you can see whatever the different bills are for the same visit. We give you the clear overview on where you are in the cycle. If you have a question, you can chat 24/7 with a bot in the beginning and then a second level with a human being. Set up payment plans, pay with Apple Pay, PayPal, credit card, direct ACH, and give you a rating. So that's kind of the first pillar, which is literally a convenient consumer interface. The second pillar, Edwin, is personalization of the billing. So when you right now look onto your Amazon account, it looks different from mine, right? Because Amazon understands what drives you to do something. Or when you look your Netflix suggestion, it looks very different from mine. And that's what we do in healthcare billing as well. So we basically reach out to patients through a different channel with a different message at a different time with different follow-up messages based on how patients interact with the system. So that's the second piece, which is this deep personalization of all this billing. And then the third pillar is it's basically an enterprise software for the healthcare system that they use in order to interact with the patients with the chat and have detailed reporting and analytics on what was going on their patient billing. So that's kind of all these three patient features. We started with a post-visit billing, and then did another few workflows that really help the patients guiding through the problems. For example, insurance denials. We have a process that helps the patient work through a denial claim, or insurance lapses. They can take a picture of the insurance card. We can resubmit the claim. And then a new functionality is our check-in. So that means before the visit, you can already take a picture of insurance card. We do eligibility check, tell you how much the copayment is. You can fill out the forms already and do contactless check-in. So that's on the product. I think your second part of the question was, what is the impact? So the impact on patient satisfaction is what we are the most proud of. And patients give us right now more than 90%, give us 4 or 5 stars. So extremely high patient satisfaction. And why is that? Because the expectation is pretty low. And having a delightful experience then really enchants them. So I think before that, and Edwin, you might laugh about this because you know the experience. I think the NPS, Net Promoter Score, for the healthcare billing was lower than visiting the DMV. So extremely low. So just bringing that to a normal status is actually really, really good. So that's what we are working on. Then the second impact is, what are the payment rates? Because health systems, they are suffering a lot from patients not paying their bill, right? And you know that they are, of course, very low margin businesses. So we see an average, an increase of around 30% of the payment rates of the patients. They pay much faster. So reduction in the time to collect by around 50%. And then, of course, we're also reducing the cost to collect because of all of those different ways on how we eliminate waste, like, for example, inbound phone calls or sending physical statements. So all of that together clearly says happier patients, pay more, pay faster, and have a more efficient process.
So this is a question that I didn't have the original questions, but the healthcare, the companies that you're dealing with, they've lived in a world of opacity, and now all of a sudden you're bringing transparency to it. How do you get the healthcare providers to move from a world of hidden information to one of transparency?
Very good question. And of course, we are having these discussions pretty often also with our clients. The interesting piece, in general, nobody wants this opacity because it doesn't help anybody. It frustrates patients. And where does that land? It lands on the desk, the complaints of the CEO or CFO of the healthcare system. Healthcare systems hate that as well. They don't want to treat the patients just like that. The problem is the following. They don't have the technology to really give the transparency in this opacity of all the healthcare billing. Because most of the systems were built kind of in the 80s or 90s are on-premise softwares, enterprise softwares that are not really made to interact with the patients. So we are kind of the connection between the healthcare system and the patient, and we can translate these things. So when you, for example, look 20 years back, there was barely any out-of-pocket payments. Everything was through the insurance. It just came over time. So all the processes and codes that were developed, they were not made for patients. They were made for insurance billing. And they still work fine for that. But they don't work at all for the patient billing. So what they are really lacking is the technology to connect the ERP systems, electronic health record systems, to the patient. And Cedar is the glue in between both of them in the connection.
So can you tell us about some of the healthcare providers who are partnering with Cedar?
Sure. We have basically across the country and across all sectors. So some of them are here in New York, physician groups or hospitals, like, for example, WestMed Practice Partners, Crystal Run Healthcare, Maimonides, Montefiore Health System. And then we have some larger academic medical centers like University of Southern California. We have Novant Health. We have Yale New Haven Health System. We have Christiana Care, and also some large other physician groups like US Anesthesia Partners or Summit Health here in New York.
And so what impact has COVID-19 had on Cedar?
Yeah, it's a good question. I think COVID, of course, is a deep humanitarian crisis, and the impacts on Cedar are dramatic, right? So it's maybe let's maybe distinguish that in two buckets. The first is what is the real impact on Cedar as a company, and what is the impact on our clients, which of course goes back to us as well, but it's two very different impacts. So for us as a company, I would say the impact in general is as it was for almost anybody else. We needed to shut down our office. Safety of our employees was the number one we really cared about, and nothing else. We needed to develop this muscle of working remotely, which is very different, keep up a good culture, handling everything right now from home. And we are still, of course, right now, 1 year in a remote working environment. Then the question is, what was the impact on our business and on our clients? That was, of course, really, really fundamental, because all of our clients, it literally came like a hurricane through them and wiped out their completely normal business, right? They needed to switch from business as usual, doing elective surgeries, procedures, towards becoming emergency rooms for a disease that you didn't really know how to treat. So they were severely disrupted, and of course also in the beginning, especially in the second quarter of last year, on how to run their business and how to do modernization of the IT infrastructure takes a second place, right? A second place on priority. Things on how, for example, to do right now scheduling, contactless check-in, communication with the patients. A lot of the patients moved their addresses. So doing somehow a communication with them on a non-physical way was way more important. So we had a lot of things that we needed to change in our product, and we adapted very nimbly. Definitely big change for them. Most of the healthcare systems, I'm so really surprised and impressed by how they switched over. I think it took them literally 8 to 12 weeks to go from defense to complete offense. And with offense, what do I mean is, okay, this is a way how we have done business before. We want to improve and we want to change that. And even though that most of the financial people or the technology people in healthcare systems right now are still remote, they are going aggressively to position themselves for the next few years, and modernizing the technology is, of course, one of the parts of that. And the demand for Cedar has increased a lot over time after this initial shock.
So in March, Cedar closed on a $200 million Series D that was led by Tiger Global Management. Can you walk us through the early stages of the financing to your Series A and ending up with your Series D?
Yeah, happy to talk about the financing history. So our Series Seed, very beginning, was done by Thrive Capital. They were the lead investor in SV Angel. Then we did our Series A, and that was in mid of 2016. Later in 2016, we did a Series A led by Founders Fund. Then our Series B was done by Kinnevik. That was done, I think, in 2018. And then we had in 2020 our Series C that was right, I think, in June 2020, led by Andreessen Horowitz. That was a $100 million round in equity and debt. And then we just did this $200 million round led by Tiger Global.
So Forbes elected you the best startup, one of the best employers in 2021. Can you tell us some of the management tools and philosophy that led Forbes to that conclusion?
Yeah, we are of course very very humbled by that, and it's definitely not the effort of just one person, but the effort of every single team member to establish a culture where people want to work and feel purpose. And I think there are a few things that really matter to people in their working. And I think the first is to do something that has a purpose and that has a mission. And something like Cedar is, of course, very, very attractive for everyone, because everybody is a healthcare consumer. Even if you're in general healthy, you get these bills. Even if it's just for the checkup or if it's for a routine procedure, you know this. Even if it's not for yourself, you know it from relatives that have the problem. Healthcare billing is a big problem in solving that. And it hits patients when they are the most vulnerable, when they are sick. So improving this somehow, I think, is very, very motivational for people. So that's what I think is one of the most important things. The second piece, what we think is very important, to have everybody feel like an owner of the business and being in charge of improving this. And that, of course, only goes through transparency, freedom, and giving people, the flexibility to work on something, but also puts accountability on them to use their good judgment. So people have the freedom to work basically wherever they want, on whatever they want, as long as it is dedicated to our vision and gets us closer to that. But we, of course, put also the burden on every single person of us to use the good judgment to get us further towards this vision. So transparency is a very important piece so that everybody really feels like an owner. We are sharing all the financial information with every single team member. We are sharing the board presentation with every single team member. All of the sensitive information, everybody knows about that. So we think that is extremely important. And then, of course, last but not least is the quality of the people that work here. We are extremely selective on whom we hire, and we invest a lot in learning and development of existing team members, because we know that one of the biggest biggest source for leadership talent is within the company, and having people that are aligned with our mission and that fit the values of the company. Training them to acquire skills that are needed to grow the company is, of course, the best way to do. So all of that together, I think, makes Cedar an extremely attractive company to work for. And we are, of course, humbled by any external recognition of that achievement.
So let's talk about your growth strategy. You've got 200 million plus in the bank. So is it going to be internal growth, or are there any acquisitions on the horizon?
Yeah, so it's a good question, and I think let's maybe take a step back on why did we want to raise the money. So we wanted to raise the money because we knew exactly where to deploy the money in terms of growth. And there are basically two big buckets on where we want to grow. The first is we want to improve our product. And how do we improve our product is, of course, we need to hire engineering and product in data science and design. So everything that is on the maker side. Because we know exactly patients like us right now, patients engage with us, but we want to resolve way more of the use cases for them. So that's where we are putting a lot of effort into it. The second way to grow for us is on the commercial side, because we want to touch more patients. How do we touch more patients? That means we need more health systems partnerships in order to interact with more of the consumers. So go-to-market is also one of the buckets on where we are going to invest in. Most of this, of course, is for sure organic. We don't have any acquisition right now that we are looking at. I don't want to exclude this. It can, of course, happen at some point if we think that a certain company has interesting product, interesting talent, and a complementary part of that. Then we wouldn't be opposed to that, but nothing is right now in the plan.
So you wrote an article about what can healthcare learn from Apple Watch. Can you share some of your insights on what healthcare can learn from Apple Watch?
Yeah, of course. It's a lot of things, but I think that the very first thing what healthcare can learn from that, and the Apple Watch is basically more, I would say, an analogy of other consumer industries, right? So when you look at the Affordable Care Act and or Obamacare, one part of that is that the health system need to adopt the electronic health records. You needed to pay health systems an incentive of around $50 billion for them to adopt the technology. That's a lot of money. They adopted the technology, but it was painful for them to use it. So you needed to add another $15 million for them to use the technology, really. So that is a very bad technology, in my opinion, if it's not beneficial for them to use it. How many people do you think you need to pay in order to use the Apple Watch? Nobody, right? Because just the value of the technology is so high. It is very intuitive and very transparent. And that is, I think, the fundamental concept, what I strongly believe. It is important to develop a technology that the consumers want to use. When the consumers want to use something, they're adopting it. They are willing to pay for it, and they're delighted to use it. And that's the only way to really, I think, distinguish the experience and make the consumers happy and reduce somehow the pain that they have when they're the most vulnerable, when they're sick.
And so, is there any part of the Cedar story or your personal story that you'd like to share that you haven't covered?
No, I think, overall, we did a good job on talking about a lot of things. But I think if I want to stress a few things, I think the first, it seems right now that Cedar is already very far along the process and has completely penetrated the entire market. Although I think Cedar is interacting with millions of patients during a lot of visits, we still have so much more room to grow. I don't think we have even right now penetrated the market by more than 1%. So there's still a lot of room to grow and a lot of complexity and suffering. And the second piece is that Cedar is not necessarily got started with the mission to be the better billing vendor. That is only one part of our product. But we wanted to be the connection between the consumer and healthcare system, starting with billing, because billing is right now the number one problem that patients face. But on top of that platform, we want to build different products so that at some point we literally become this connection between the patient and the healthcare system.
And I didn't do any research on this, but I know there's been a little coverage of the role that states play in terms of transparency in hospital billing rates. Are you seeing that, and what are the implications for Cedar?
Yeah, it's a great question, and of course a very hot topic right now, because that's one of these. The Transparency Act is one of the very few legislations that has bipartisan support. So these things still exist, and I think it's very motivating because it makes total sense. It's just inhumane to think this doesn't make sense. There's one big problem on that. The idea is great, but the execution of that is very, very bad. All of the prices right now are being displayed on a health system, or they need to pay a fine. Some health systems just pay a fine, but they are right now machine readable on the websites of a lot of hospitals. What is the impact of that right now? I think it's very low because it's not digestible and readable for the patients. So we are still having the problem that the idea is great, but it's not very usable for the patients. So I strongly believe that we need more a consumer-facing technology to make this communication between what the government says or CMS says to check the box towards what the consumers really need. And that's where, of course, Cedar will play a big part in the role. And we are working hard on making it digestible for the patients.
So I really want to thank you for your time. It was a delight to meet you. And I interview people that disrupt industries, but you're disrupting a nightmare. Anyone who's been through the healthcare, who's had a bill from the healthcare industry. And I'm delighted that you decided to stay in commerce, because I'm in the midst of reading Walter Isaacson's The Code Breaker. And I don't know if you've read it, it just came out, but Jennifer Dudas spent a month in Genentech, and she said, I need to be a researcher for the rest of my life. So I'm delighted that you've pursued your career as an entrepreneur, and it sounds like your company is going to be changing an important part of the healthcare landscape. So continued success, and bless you.
Thanks a lot, Edwin. And I think a lot of hard work in front of us, but we are motivated in order to make at least a small dent on improving the lives of fellow citizens.